We see a lot of older patients with knee replacements, and this trend is just going to keep continuing. We encourage patients, go to a place that does the rehab for knee replacement all day, every day. They're better at it. Go get it done and meet all their goals and keep working for it. It's just not getting that range of motion goal, but getting that strength and endurance. And many times patients will slide off. They'll feel like they graduated, back off, and then they're back into our office with either an aggravation of a knee or back, and we'll go to check some of the fundamentals. Like, I can see the scar. I can see it's pretty recent. We talk about it. All right, well, let's see how you stand. And it amazes me how many times people just feel like, all right, once I meet the goals, once I go in X number of visits, I'm good, my knee's great. But then we run them through a few tests and they find, yeah, they still don't have some of the balance on that leg yet. They don't have the stability. They're still cheating a little bit to the other side. And we just kind of retweak, rework the exercises to get them to start progressing again and making progress. And what they did was great at the beginning, they just didn't continue it on their own. They didn't get that single leg stance and stability. They're still a little wobbly. They don't have some of that glute or back strength to go with it. And it's just not from the surgery, but you think they earned their surgery with a lot of degeneration and wear and tear in that knee, and because of that, they were cheating and compensating in that low back. They were cheating in their hips. They were trying to find ways to get through their day without putting more strain on that knee. And they need to work on exercises, stretching activities to undo those years of compensations so that they're in a good spot once again.